Your child will soon be undergoing a tracheostomy procedure. In this video, we are going to discuss the purpose and outcome of this procedure and the training required for parents to prepare for at-home care. A normal breathing pattern draws air through the nose or mouth into the windpipe and then into the lungs. The lungs take in oxygen from the air when breathing in and get rid of carbon dioxide when breathing out. A tracheostomy is necessary when breathing becomes difficult. This could be because of an obstructive or narrow airway, a congenital syndrome, an increased amount of secretions that need to consistently be suctioned, or when a patient requires a ventilator for a prolonged period of time. So, what is a tracheostomy? A tracheostomy, also known as a stoma, is a small opening made from the skin to the windpipe by a cut in the neck. The tracheostomy tube is a short plastic tube placed in the windpipe through a hole created in the neck during surgery. This procedure is performed under general anesthesia. The trach tube inserts into this hole, resting in the throat. It does not reach into the lung. There will be a part of the tracheostomy tube that lies on the outside of the neck. Tracheostomy tube allows for movement of air and removal of secretions. Once placed, your child will breathe through this trach instead of their nose and mouth. At first, you will not be able to hear your baby or child cry or talk with the tracheostomy tube. Sometimes, an air leak develops around the trach tube, allowing air to escape through the voice box, permitting some return of voice. Speech therapy is an option in order to learn how to communicate with a speaking valve, as well as using pen and paper or sign language. The tracheostomy tube comes in many varieties. Your healthcare provider will give you information regarding your child's trach tube during your hospital stay. This will include information on the kind of trach tube your child has, the suction length, and more. Know that the different types of trach tubes correspond to the size and structure of your child's trachea. We understand that this is a stressful time for your family, and the care required at home can be overwhelming. Your child's care team is there to help you, so know that you aren't alone in this. To ensure the safest care for your child at all times, there must be 2 caregivers educated on the child's care. This training should take about 3 weeks to complete. During the training period, both caregivers are expected to be at the bedside as much as possible. Before you make a decision about which caregivers will need to be trained to care for your child, consider the skills that these people will need to learn. 1. How to suction mucus and secretions from the trach tube. 2. How to change the ties that hold the trach in place. 3. How to perform a tracheostomy tube exchange. 4. How to recognize signs that your child is having trouble breathing and what to do if this happens. 5. How to perform CPR on someone with a trach tube. And 6. How to operate any special equipment that your child needs, such as a monitor or suction machine. These skills will be monitored by the nurses throughout your stay. Caregivers are expected to be at the bedside as much as possible to receive the proper training. You will be trained on how to use hospital equipment before moving on to the equipment you will be using at home. It's essential that you have a firm understanding of how to use these devices. To ensure that you and the second caregiver can safely and comfortably care for your child, you will each be expected to room in. The purpose of rooming in is to simulate the home environment as closely as possible while having the support of bedside staff. The 2 adult caregivers must meet all parts of the teaching plan and complete all checkoffs prior to rooming in. Rooming in will show that you can care for your child without coaching from the nursing staff or other family. This process will last for 48 hours. During room-in, the child's designated caregivers will provide all care and take turns sleeping. A member of your child's care team will assess the patient regularly and help make a schedule so the caregiver is more comfortable and familiar with patient needs. This video was created as a part of a series of tracheostomy care videos which align with the educational rubric at UF Health Shands Children's Hospital. The other videos within this series cover very important topics, such as cleaning tracheostomy sites, changing tracheostomy tubes, and tracheostomy CPR. We hope that our resources provide you with the confidence to care for your child at home, or wherever life may take you.